Hi everyone, my name is Judy Zhong and I am a rising sophomore at Duke studying economics. This summer I worked with Matthew Maciejewski on a project called The Relationship Between Antidepressants and Bariatric Surgery Outcomes, a literature review. So I'll obviously first start with the introduction. So the obesity epidemic in the United States is a rising and very complex public health problem. In 2015 and 2016, the prevalence of obesity rose to 39.8% among adults in the U.S. Obese patients are more likely to have comorbid conditions such as type 2 diabetes, coronary heart disease, etc. And this is especially prevalent in those who are morbidly obese. Bariatric surgery is an emerging treatment. It's a weight loss surgery that's used to promote weight loss in those who are morbidly obese, and has also been found to cause reductions in comorbid diseases. With the high incidence of also psychiatric conditions in this population, we need to better understand the relationship between bariatric surgery and these psychiatric conditions. And currently there's not much literature that explores this relationship. There's a lot of literature on obesity and its other comorbid conditions, but not a lot on obesity and psychiatric comorbidities. And so this is what this project is going to look at, is we're going to analyze some literature and look at the relationship between bariatric surgery and antidepressant utilization. So this literature review is actually part of a larger research project called the Long-Term Mental Health Outcomes of Bariatric Surgery. It's looking at the long-term outcomes, whether that be alcohol use, antidepressants, of veterans who underwent bariatric surgery and veterans who did not. One thing to note about the veterans population is that they're predominantly older males, while most research in obesity has been focused on a predominantly female population. For this large research project, they have already completed some papers and some studies into whether long-term weight loss is sustained in this population of predominant males, and it has been, as shown in Figure 1. That just shows like how there's sustained weight loss in this veteran population. And also there has been a previous paper looking at the association with unhealthy alcohol use, but the current ongoing studying that we're working on is examining how post-surgical weight loss differs by antidepressant class used by veterans before surgery. So now I'm going to break down the objectives of this literature review into different focus areas. Again, this literature review was to help inform the larger ELMO study, the long-term mental health outcomes study, and this is going to be a narrative review. Focus area 1 is looking at the impact of preoperative antidepressant usage on post-operative weight change. Focus area 2 is on the effect of surgery on post-operative antidepressant use. Focus area 3 is on the pharmacokinetic effects of surgery. We are mainly looking at focus area 1 because that directly feeds into the purpose of our actual study, but focus area 2 is also important to look at. As for focus area 3, it's not that important, but we still decided to look at the literature for that. So now I'll go into the review process and then kind of our results. So for our literature search, we did a PubMed search, and then from the PubMed search, we identified some key mesh terms. And then once we found all the papers through the mesh terms, we did some backtracking and looked at the similar articles / cited by articles. And once you identified those papers, we did some data extraction. If you want to look at the mesh terms, they're also provided on the poster. So first we skimmed the abstracts to determine if the paper was relevant to what we were looking for and fit the different focus areas, and then we would skim the entire paper to see if it actually did fit the focus area. And then we would extract certain data elements. The data elements are listed below, but some important data elements I'll briefly mention is like psychiatric like history or information, and also specific numeric results, methods of assessment, and the different types of medication used. And then after we extracted these data elements, we decided to categorize the papers based on different focus areas. So for the results, we looked at a total of 15 studies, 10 were empirical studies, and 5 were commentaries. For the results section, I'm only going to talk about focus area 1 and focus area 2, because most of the commentaries were in focus area 3, which is about the pharmacokinetic effects. So there's not that much substantive like empirical studies on that, so I decided not to talk about that for the results section. So for focus area 1, weight change, if you look at the first graph on the left, you can see that percent total weight loss between the treatment and control groups. The treatment group is those that had or used antidepressants, and control groups are the ones that did not. There's not much difference in percent total weight loss after surgery. So again, it seems that antidepressants as a whole doesn't seem to have an effect on weight loss. But Plake, which is a certain paper that we were looking at, used a different measurement for a weight loss. It used percent excess BMI loss, and from that, it found that antidepressants was actually associated with reduced weight loss. So it kind of depends on what measure that the study was using, whether that be excess BMI loss or percent total weight loss. And most of the studies use percent total weight loss, so that suggests that percent total weight loss might be a better or more universal measurement as opposed to the excess BMI loss used by Plake. As for looking at different specific classes of antidepressant, if we look at the second graph that's on the right, you can see that Plake and Hawkins both looked at different classes and broke down the classes, and the classes are grouped by color. And as you can see, if we look at SNRI specifically, because that's a shared class between the two papers, that with the percent excess BMI loss measurement used by Plake, it predicted that SNRIs had a negative effect on weight loss, meaning it resulted in less weight loss, while Hawkins, using the measurement percent total weight loss, found that it actually had a positive effect on weight loss, meaning it resulted in more weight loss. So again, there's a kind of tension between what measurement is best used to determine weight loss and what conclusion is more representative of the population. So for focus area 2, it's looking at antidepressant change before and after surgery. In both the papers, it found that depression and most psychiatric disorders and antidepressant use declined the first couple years after surgery, but then saw a rise to pre-surgical levels as the study was extended and the studies that looked at longer time periods. As for conclusions, again, there's conflicting findings on the impact of antidepressants on weight loss, whether that be the measurement percent excess BMI loss or percent total weight loss. Certain antidepressants classes may affect weight change differently. So specifically the SNRIs that were examined by Plake and Hawkins, there is some conflict there, but it's very clear that different classes may have different effects just looking at that graph and looking at the different bars. And antidepressants and depression fell first and then rose post-operatively. And as for focus area 3, based on the commentaries I read, the absorption of drugs seems to be greatly altered, meaning that drug absorption is not the same as it was pre-operatively. There's some consensus in focus areas, such as the reduction in antidepressant use after surgery, but there's also some discord between the papers. Again, like the conflicting measurements used to determine weight loss. But I will say that most of the papers, again, use percent total weight loss, so maybe that is the more universally accepted measurement, and maybe we should consider looking at papers that only look at that or use that measurement. As for future directions, again, this literature review will inform ongoing outlaw studies about weight change by antidepressant class 5 years after surgery. So most of the weight change papers I looked at were only looking at 1 to 2 years after surgery, while our study is going to look at 5 years. So maybe there's some changes in the data there or some different trends that we'll find. We definitely, this literature showed that we need a standardized measure for weight change, because there is some differences on how to best measure weight loss, and there definitely needs to be more studies into the pharmacokinetic effects of different classes. Again, most of the papers we looked at were only looking or doing commentaries on that. This may suggest, or at least from our study, we may find that certain antidepressant classes are going to be preferable post-operatively because they will either increase weight loss or not result in reductions in weight loss. And this has the potential to guide better clinical practices, meaning physicians can be guided by these results to figure out what prescriptions are best for their patients. And as for acknowledgements, I would like to thank all these people listed on the poster, especially shout out to Matt, Virginia Wang, Nikki, and all the librarians and all the Huang Fellows and the Duke-Margolis team for helping me with my research this summer. Thank you so much.